Hello, everyone. It's Professor Mo from Rofem NCLEX Academy. Let's answer these practice questions together. Take a look at this one. The rhythm below is for a patient admitted to the cardiac unit. Patient appears restless. Identify the rhythm. So, what do you think? If you look at this rhythm very well, you will see the irregularity in the rhythm. Now, take a look. Now, from one QRS to the next one, compared to the one after that. Also, there are no P waves on the EKG. Ventricular rhythm is also irregularly irregular. This rhythm is atrial fibrillation. In atrial fibrillation, the upper chambers are not beating effectively. They just quiver chaotically, leading to rapid, irregular pulse. This is another one. The rhythm is atrial fibrillation. Which of the following can happen as a result of this rhythm? Select all that apply. So, what do you think about this one? Take a look at all the answer choices. What do you think? What we are going to do is we are going to take the answer choices one by one so that we'll see which ones are correct and why they are correct. So look at answer choice A, decreased cardiac output. This is correct because in atrial fibrillation, the heart rate is really, really fast, leading to a decreased ventricular filling time. And that is why there is decreased cardiac output. Because of this, some patients are clammy, lightheaded, and they also have decreased blood pressure. Take a look at answer choice B. B is also correct, pulmonary embolism, because there is quivering of the atria rather than effectively contracting to pump blood. What that is going to do is it's going to allow blood to pool in the upper chambers. That will result in formation of clots. When the clots break from the right atrium, where is it going to go? It can cause pulmonary embolus, and the clot from the left side can travel to the brain, resulting in a stroke, which means answer choice C is also correct. Take a look at answer choice D, addiction. There is no evidence that atrial fibrillation can lead to addiction. In answer choice E, this one is correct, our failure, because the rhythm in atrial fibrillation is very fast and irregularly irregular. Over time, the rapid heart rate can weaken the heart muscle, which means it's now going to be able to pump enough blood to the rest of the body. The correct answers are A, B, C, and E. Let's take a look at this one. For the patient with atrial fibrillation, the EKG rhythm is shown below. Which medication or medications do you expect the doctor to order? Select all that apply. So take a look at all the answer choices. Which of them would you select? So we are going to look at the answer choices one by one. Medication for the treatment of atrial fibrillation. Of course, that would include beta blockers because we want their rate to be controlled, and that is what beta blockers will be used for. Anticoagulant will be correct as well. That would be to reduce the possibility of a pulmonary embolus or a stroke. How about answer choice C? Antiarrhythmics, example is cardizem or amiodarone. These medications can also be ordered to see if the arrhythmia will convert to a sinus rhythm. When you look at answer choice D, digoxin, of course, digoxin will be ordered to treat a patient with atrial fibrillation to slow down their heart rate. Answer choice E is not correct because medications like decongestants can increase the heart rate and even blood pressure, and that will increase cardiac workload. So they are not good for patients with atrial fibrillation. And that means we do not expect decongestants to be ordered for a patient with atrial fibrillation. Now let's take a look at this one. The rhythm is atrial fibrillation with a ventricular rate of 140 beats per minute. The client reports palpitations and difficulty breathing. Which medication should the nurse prepare to administer? So take a look at the answer choices. Which medication will you prepare to give to this patient? The correct answer is A, digoxin. Digoxin helps to control ventricular rate in atrial fibrillation. Now, look at the other answers. Atropine and epinephrine will increase heart rate, and that will only make the tachycardia worse. We don't want that. Dopamine is used for hypotension, and it may actually increase the ventricular rate in atrial fibrillation. The correct answer is A, digoxin. Thank you so much for watching and learning from this video. Like, share, comment, and subscribe to this channel to stay updated. If you have any questions, you can place them in the comment section. See you next time.